I don't know what's going on. What's going on?
They told me that your girlfriend told us that you were suicidal.
My girlfriend?
Yeah, your girlfriend.
There are numerous counties in South Carolina who the only psychiatrist in that county belongs to the Department of Mental Health. If we think about a patient who presents to the emergency room with a problem that might require not only an accurate diagnosis, but then the beginning of treatment, which might be medication, ordinarily the emergency room doctor wouldn't be a person who would be familiar with all of the elements that go into that, particularly if it's a complex issue.
Did you send her a text saying you wanted to kill yourself?
Not like that. Not like that.
So a patient who is able to access our psychiatrist is not only able to get that accurate diagnosis, but also begin treatment right after the consultation.
We have this new program where we can teleconference with a clinician and just maybe get to the bottom of it and see what they think. Are you willing to take part in this?
Do I have to?
The police officers are worried about it, and we did see the text message that said you were going to kill yourself. So
I guess so.
Okay. So I'm going to call Mobile Crisis. Hey, Mobile Crisis, this is Chris Hall with Charleston County EMS. How are you?
So we've been working with Mobile Crisis for a long time. We used to do call-outs where Mobile Crisis would actually come to the scene. Then we started work to put together this program with the idea of reducing the number of patients that actually go to the ERs for these complaints and getting them the resources they need directly.
The way it works is 911 call comes in, there's a suicidal patient. The ambulance responds to the scene with an officer to assess for safety.
The ambulance always goes to the scene first, and they're going to do a medical screening on the patient. And when they do that medical screening, they just make sure that there isn't an immediate medical concern where the patient needs to be in an emergency department. It's not a diabetic issue, or they don't have very high blood pressure, something along those lines.
Once they deem that there's no medical emergency, they call their supervisor to the scene who's in a Tahoe. Once that guy gets there, then the ambulance can leave and respond to the next medical emergency.
It prevents our transport unit from being tied up in that transport when that's not really the resource they need. So we have our quick response vehicle stay on scene with the patient, and we get our ambulance available to take that next emergency run, which could be the patient with chest pain, a heart attack, something like that.
EMS calls us, who are trained more in depth with psychiatric emergencies, and we're able to do a more thorough assessment to assess for safety and determine, do they need to be in an ER? Do they need to be in a psych facility? Can we get them here? Safety plan and get them here.
From our side, we're using a laptop with a webcam and some software called Video. With that software, they connect and they can see the mobile crisis provider, and the patient can actually see them as well. This program is designed to get them directly to the care they need.
Every ER diversion that we can create saves the community relatively $1,500. This EMS project that we have, the telehealth project, is really resulting in a lot of ER diversions. And EMS is not transporting. Since May 1st, they've called us 400 times, and they've only transported 11% of those patients.
It's very important for us. I mean, I think for a long time we didn't even realize it was something we were missing out on. And then we started to integrate with Mobile Crisis and develop this relationship. And even when the video consult isn't appropriate, we've actually tapped into that resource more than we ever did before.
To see it grow and expand like it has, but now we're creating these programs like this telehealth project, where now we're able to reach people in rural areas. Charleston has 3 psych facilities. Most counties don't have any, and they have to go to Columbia if they're going to go to a psych hospital. So we want to be able to reach people in those counties that need it, that have mental illness. This is a very hard-working team. They wear several different hats. It's very fast-paced, but they all have the passion, and at the center of their hearts, their goal is to help save lives and to help better lives.